Good afternoon, everyone. Thank you for being here today. And I want to update you on where Arizona is in its current situation, where our numbers are, and the action steps we intend to take going forward. I want to begin by just again saying thank you to all of our nurses, doctors, emergency medical responders, and healthcare workers, everyone that works in healthcare or in a hospital. They are on the front lines, they are in the thick of it, and they have our undying gratitude. I'm also going to talk about some things that we can do today that will help them, help relieve the heavy burden that they have at this moment. I also want to emphasize that you are safer at home at this time in Arizona. We're going to see some evidence today that people have actually been listening to this message over the last 10 days, and I want to thank the press in advance. You helped us communicate that message. People are understanding it, and I'm going to ask you to continue to help amplify that message in the reporting around COVID-19, that people are safer at home, and if they don't have any place to go, stay home. These are the latest numbers in Arizona: 108,614 total COVID-19 cases. On July 5th, we surpassed the 100,000 number mark. We have had a brutal June in Arizona with a 50% increase. And of course, our thoughts and prayers and sympathies go out to everyone that has been affected by COVID-19, which is basically everyone in our state, but none more so than the 2,038 families that have lost an Arizonan. These numbers are going to show where we are and also where we're making some progress and what our opportunities are in Arizona right now. Our COVID-like illness continues to increase inside of emergency rooms. COVID patient use is up, and so is the percentage of positive tests. So we see increases across the board. I'm going to take you through the metrics quickly. I think you've heard some people incorrectly say that this is like the flu. If you look at the gold line, that is the flu, that's influenza. It's behaving like the flu does. COVID is different, and it is on the rise in Arizona in terms of surveillance. I do want to point out that if you look at what has happened over the last week, we see our first flattening and slight decrease. These are our COVID-19 cases by day. A lot of information on this chart, but I want to point out a new metric that we added. That's when the stay-at-home order ended. So if you think back to the beginning, and we've all been dealing with the coronavirus for some time, the emergency order was put on March 11th. Our stay-at-home order ended on May 15th. If you look along the way, we never had much of a rise in cases. After the stay-at-home order, we had a couple of weeks where there was not much of a rise in cases, and then you see a rapid increase in cases throughout June. These are our percentage of positive tests. The blue is the amount of tests, so an ever-increasing amount of tests, and we need more. I'll talk about that. Again, look at when the stay-at-home order ended. You could see that we had weeks of decreasing positivity in our tests, and what we have had since are continuing weeks of increasing positivity. So our positivity is way too high. We are testing sick, symptomatic, and people that have been exposed to COVID-19. So we expect positivity, but this positivity is too high. What it means is that the virus is widespread, and the more activity that is happening in our economy the more the spread will continue. Again, validation that you are safer at home. This shows you where we are in terms of hospital beds rising. What I think is the line to look at are the orange bars. That's inpatient for COVID, and that's also increasing. Same with intensive care unit hospital beds for COVID-19, an increase in COVID-19 usage. I want you to know that these numbers, while they do show availability, they show hospital beds and ICU beds, they do not show surge capacity that we have. This is in our current hospital system and infrastructure. This is ventilators. It's a rising number of ventilators, and people in the most need these ventilators, and that is increasing as well. This is our testing by day. You can see an ever increasing amount of testing. This is the same numbers, but we're showing it in a different way. You can see the surge by the height of the testing. That's on the weekends, and then you see the decrease during the weeks. Over 841,000 tests have been completed in the state of Arizona. 418,000 in terms of diagnostic, and 188,000 plus in terms of serology. I think everyone's become familiar with those terms. One tells you if you've had the virus and since recovered. The PCR test tells you if you're sick today. We've taken recent actions to slow the spread, which is necessary in the state of Arizona. 10 days ago, we prohibited large gatherings. I want to thank our local leadership, mayors and county supervisors, for the local mask ordinances and the cooperation of Arizonans in following those mask ordinances. They make a difference in slowing the virus. We paused operations on gyms, bars, nightclubs, water parks, and tubing, and delayed the first day of school. And by and large, we've seen compliance. There have been outliers, but by and large, compliance across the board. So let's track the results. Are these decisions, are these actions having an effect in Arizona? And let's look where we are today. One thing I talked about 10 days ago was the R0 number. That's the average number of people who become infected by an infectious person. It's a way that epidemiologists measure how quickly the virus is spreading. 10 days ago, on June 29th, our R0 in Arizona was 1.18. And if you look, I think on your screen, it would be the far left. I want you to also see that Nevada was in a position with the highest R0. You want your R0 to be below 1. That's the objective. Arizona was at 1.18, and Nevada at that time had the highest in the nation. 10 days later, Arizona's at 1.1. Yesterday, we were actually at 1.08. Okay, so we had reduced it 10 basis points as of yesterday. Today, it's up 2 basis points. So dramatic movement in 10 days and over the 10 days that were the 4th of July weekend, a time when probably many people found it difficult to restrict activity or to stay home. But I want people to know that their actions and their decisions can affect the spread of this disease. And let's take a look at where Arizona is in comparison to others that are out there. The reason I called out Nevada was 10 days ago, they were at the far left side of the graph. They've made dramatic progress in the last 10 days. I talked to the governor of Nevada yesterday, comparing notes on actions and decisions that we were making. We both want to work as hard as we can to get this number below 1, it will mean that the virus is truly spreading and reducing. And you can see where some other folks are on the line. If you go to //rt.live, that's the website at the bottom left of the page, you can see where every state is and drill in specifically on Arizona. But the goal here is to be less than 1. And the decisions that we're making are to slow the spread of this virus so that we can protect the most vulnerable, so that we can care for people, and the best way to do it is not get it and not spread it. Let's take a look at some information and data on Arizona. Now, this is how the number of cases have changed over the last week. To simplify this chart, red and the more dark red, or bright red, I should say, are hot spots. Orange is also rising, but less so. Where you see blue, it's decreasing, and where you see yellow, it's stabilizing. This is something that we track. It shows us where hot spots are in the state. We are seeing some stabilization, but we need to see a decline across the state. If there was a takeaway on this graph or chart, in addition that we have made some progress in the last 7 days, it's that no county in Arizona, no matter how rural or how sparsely populated, has been spared. Of course, different counties have been in a different situation, but this has affected every county, all 15 in Arizona. Now let's look at the newly reported cases by day in the state of Arizona. And you heard me talk about the stay-at-home order ending in May. And if you look at this graph, you can see where mid-May is and where our number of cases are. The stay-at-home order was lifted on May 15th. And for 2 weeks following that, we were flat. And then there was a rapid rise of these cases in June. Now, I want to point you to 10 days ago when we put these actions of shutting down bars and gyms and tubing and other things. You see a flattening. You see a plateau and even a day or two of decrease in cases. This is encouraging. It's encouraging that the actions can have a result and further actions can have a greater result. So try to hold this graph as you can, if you can, in your mind's eye and see that in Arizona, our rapid increase was in June. And let's compare that to the nation. In the United States, we were seeing a decrease through May and through June, when Arizona was seeing its rapid increase. What you see for the country in July is a rapid spiking and increase of these cases. It's possible that Arizona was the front of that wave of increases in these cases, and the actions that we're taking can lead the way for our state to navigate forward. And you don't have to take it from me. I want you to take it from Dr. Deborah Birx, who was in Arizona last week. Arizona does have 3 counties that we're tracking very closely, the largest one being Phoenix and Maricopa County. The 7-day average is showing some flattening, and we find that encouraging. We're hoping that it heralds a stability in Arizona that at least plateaus their curve. I just got off a conference call with Dr. Birx and Dr. Christ at 1:30 today. I want to thank Dr. Birx for the time that she spent in Arizona. I want to thank her for what she shared on the model that she's working of and the actions that we're going to take today. She found encouraging as well. I also want people to know that I hear the criticism. And I know that there are differing opinions out there on how Arizona has handled this virus. And I want to make a commitment to the people of Arizona. My decisions are not going to be influenced by any attempt to please the press, and they will not be influenced by politics in any way. Everything we will do going forward will be to protect and promote public health in Arizona. I've talked about protecting lives and protecting livelihoods. And when in doubt, we will err on the side of protecting lives and proceed with caution. So let's look over the last 2 weeks how the cases have changed in Arizona and across the country. And again, the more color, the more trouble. The more bright red or fire engine red, the more dire the circumstances. Over the last 2 weeks, Arizona's map looks a lot different than it did 3 weeks ago. So we are seeing some better results. We need to see more, but the actions that we took 10 days ago are making a difference. We need to increase this difference. One thing Dr. Birx said is that we should think of this in terms of getting out of the zone that we're in right now as a 2 to 4 week event. Okay, so this idea of really pressing, this idea of striking a message that you're safer at home, this idea of finding all kinds of excuses to stay at home, is a 2 to 4 week event, and we'll continue to measure the progress and make decisions as necessary. Now, across the nation, 45 states are seeing an increase in COVID-19 cases over the last 2 weeks. The virus is spreading, and of course, we know that it's spreading in Arizona. COVID-19 remains widespread in the United States. Cases are rising nationwide, and no state is spared. So the decisions that I am going to make are going to be reflective of Arizona and Arizona exclusively. And of course, I take into account other decisions that folks have made, best practices, information that they would have. In addition to Governor Sisolak, yesterday I had a discussion with Charlie Baker in Massachusetts, Larry Hogan in Maryland. So there's a lot of discussion on folks that were hit first, hit harder than we were, and before we were, things that we can do to get our arms around the crisis as quickly as possible. So there are continued sacrifices that are needed. Someone sent me a meme a few days ago, and it showed a bunch of infantrymen storming Normandy Beach. And it basically said, our grandfathers stormed Normandy to defeat the Nazis. We're asking you to stay home on the couch and watch Netflix. Don't screw it up. So it was a momentary, funny issue in a time of real seriousness. But there really is nothing that you can do that will help more than staying home. This idea of sacrificing is really a mindset. And if you see it as helping other Arizonans, helping our state, helping our country, helping our healthcare workers, putting our kids in a position where eventually they can return to school and that we can protect the maximum amount of people and protect the maximum amount of livelihoods. There are strength in numbers along with the informed actions that we can take. So let's talk about the additional actions that we're going to take to slow the spread. And like I said, I hear the differing opinions and listen. And listen to the criticism as well. These decisions have not been made willy-nilly. These decisions have been targeted at large group gatherings and places of higher risk. And you can see this chart. This is our chart here in Arizona, but you could see a similar chart in other states. You could see a similar chart in Texas or on the CDC's website. And this is where our focus is. This is a process of risk reduction. The virus is widespread. There's not the opportunity today to talk about risk removal. It's about making the best decision possible to reduce your risk of contracting this virus, to reduce your risk of spreading the virus, and especially of spreading the virus to someone that's most vulnerable. Today, there's a new executive order that will limit indoor dining to less than 50% occupancy. Occupancy is set by the fire code. Going forward, it will be at less than 50% of that number. Some restaurants have chosen to voluntarily close. It is actually safer, if you look at the risk profiles, to eat outside. And there are many beautiful parts in our state where you can more safely do that. The objective here is, if you are going to eat inside, to make sure there are as few people as possible inside that establishment. So you're safer at home. If you're not at home, you're safer outside. If you're not outside and you are going to go inside, you want to be in places where you can limit the number of people. This executive order is going into effect in consultation with the restaurant industry. We had discussions with leaders and influencers in the industry, and I want to thank them for their input and eagerness to do the right thing. I also want to say, as you look at that chart around reducing risk and the idea of risk reduction, we are going to continue strengthening guidance in the state of Arizona. I know most of the folks in here that have worked with me over the last 6 years know my love of free enterprise and free markets and Adam Smith. In a pandemic, in an effort to protect lives and to protect livelihoods, to have some balance out there in our economy that allows it to operate, we will be more prescriptive in our guidance going forward. And we will ensure and work with others around enforcement and accountability in all our industries. And I want the leaders of our industries out there to know that we want to work with them. I am confident on some of the decisions that we've made that we will be able to make decisions in the future that allow different businesses to operate, but they will operate more safely as we navigate through this public health crisis. There's just no other way around it if we want to protect both lives and livelihoods and have some balance and operation in our economy. Also, we are going to dramatically expand testing in Arizona. I want to thank President Trump and Vice President Pence for their attention to the state, for the resources that we're going to have being brought to the state from FEMA. This is a result of direct conversations between myself, Dr. Christ, Dr. Burks with the Vice President last week. We are launching Project Catapult to dramatically increase testing in Arizona. This is a partnership between Sonora Quest Laboratories and others in the private sector with Arizona Department of Health Services. This will be an exponential increase in tests and processing tests. We will be at 35,000 tests by the end of July, 60,000 tests per day by the end of August, and we will have increased lab processing capacity, which will give us results much more quickly. So you saw where we are in positivity today in Arizona, and we are testing sick, symptomatic, and people that have been exposed to COVID-19. I also want to remind you that we had weeks in May and June where we actually didn't hit capacity of testing because we didn't have the demand for testing. Today, demand is through the roof. And I know that people not only that are sick or symptomatic or have been exposed, that everyone wants to get a test. And we want you to be able to get a test. We believe working with these private sector partners with this dramatic increase in tests, we'll be able to broadly expand our testing this month and next month to achieve those objectives. And that also gives us information of who is sick in real time when they were asymptomatic or didn't think that they had it. And then they can quarantine for 2 weeks, and again, it goes to reduce the spread. We're also going to expand testing in partnership with the Centers for Disease Control and partner with Health and Human Services to offer free COVID-19 testing, up to 5,000 tests per day. Our focus is going to be Maryvale and South Phoenix with 12 days of surge testing, and I believe Major General McGuire is going to comment more on the specifics of this, but we're hopeful to start this next week in Arizona. I also want to thank our university partners, and today specifically Arizona State and Dr. Michael Crow. The Department of Health Services is going to partner with ASU on a free saliva-based COVID-19 testing, painless. All you do is spit into a capsule, and the test is done with saliva. There's no need to pre-register for an appointment. It's free. The first drive-through will be Saturday, July 11th in the West Valley. We're going to add additional sites and days, and this will be ongoing over the next couple of months. So thank you to the researchers and developers at the university, and this testing begins on Saturday. We're seeing some progress in Arizona. We need to see more. We simply can't let up. If we will stay at home, if we will make safer decisions, if you need to do something and you go out and do it and go home, and we keep pressing, this is a good excuse to whatever series your friends have talked about on Netflix, to watch it or rewatch it, or pick up your reading habit again. But any excuse you can find to stay home will benefit the state of Arizona, will help us navigate through this, and I appreciate people for what they've done the last 10 days over the Independence Day holiday. If we can do that again over the next 2 weeks, we can be in a much different position than we are today and actually seeing a decrease in the spread of this virus. In addition to staying home, the things that you can do that make the biggest difference are to wear a mask. And I want to ask everyone to please wear a mask. Do it for your neighbor. Do it for your grandmother and grandfather. Do it for the nurses and the doctors and the healthcare workers. There is no better way to lighten their load than to put on a mask and slow the spread of this virus. And in addition, of course, this idea of physically distancing, washing your hands, and staying at home, and if sick, of course, staying at home can all make a difference. We're going to be living with this virus for the foreseeable future. And while I think Arizona's time of maximum challenge is right now, we don't know what the future holds. And we do know, as we get through summer, we head into flu season, which brings a whole different set of complications, which we will be talking about in future press conferences. But the best way to reduce the flu in Arizona is physical distancing, washing your hands. And when you can stay home, stay home. And of course, at this time, and while COVID-19 is in our midst, wear a mask. And with that, I want to turn it over to someone who's been working around the clock, has been a partner in everything we're doing in Arizona. And I want to thank you also for the time spent with Centers for Disease Control, Dr. Deborah Christ, and the phone call today as well. Dr. Christ, take it away.
Thank you, Governor. So, as we've been talking, we know that there are specific risks associated with certain activities, and you can see from that risk index that we had posted earlier, we're trying to show people that the more time that you spend with people who are not in your household, and the more time that you spend indoors in close proximity with those people, increases your risk for the transmission of the virus. So again, every time you go out, consider where you are going, why you are going, and who is going to be there. The more people you interact with, the closer you are to them, the longer you interact with them, and if you're in an enclosed, non-well-ventilated area, that is going to increase your risk significantly. So as everyone's aware, the department works very closely with our hospital partners to monitor the hospital resources that are available in Arizona. One of the things that we've identified as a need for our hospital is staffing. So our frontline healthcare workers, our nurses, our physicians, our respiratory therapists have been at this since March. We know that they have worked very, very hard. We are starting the Arizona Surge Line Staffing Initiative, which will be administering this initiative. We will provide at the cost of the state up to 20% of the staff needed to staff, staff up to 20% of their licensed beds for up to 6 weeks for hospitals. That application has gone out to hospitals so that they can apply. One of the conditions is that they have to participate in the Arizona Surge Line and that they have to improve their data quality, but we're taking applications, and so that's a huge win for us. The other thing that we're looking at is post-acute solutions. So we know that there's a lot of people who get really sick from COVID, and they may recover enough to not need to be in a hospital anymore, but they may need to be somewhere else besides going home. Maybe they live with somebody who is high risk. Maybe they still need some ongoing care. So moving forward, we're going to be working with providers across the state to increase those opportunities for patients to be moved out of the hospital into a post-acute setting so that it frees up additional hospital beds. So we are going to be looking at expanding the types of providers that can participate in our post-acute care capacity tracker. This is a dashboard that allows the hospitals to see who has open beds and who can take these patients. In addition, to encourage providers to participate in the PACT dashboard, we are going to be providing incentive dollars. We've heard from providers that they have additional beds, but they need additional staff or they need additional PPE. So we will be providing that so that they can help and take some of those post-acute COVID-19 patients. Thank you, Governor.
Thank you, Dr. Christ. I really appreciate your hard work, and someone else who's working very hard along with the brave women and men of the National Guard and the DEMA department. I want to thank you, General McGuire, your participation last week with Dr. Burks and with Admiral Polobchek, and the good work that DEMA is doing coordinating with the Federal Emergency and Military Affairs Department. Give us an update, please.
Yes, sir. Good afternoon. Thanks. Since we last met, I want to update you quickly on a couple of the lines of effort. First, the issue around PPE and the logistics issues. We continue to receive great support as we continue to stockpile PPE as well as all the equipment that the staff might need for that surge capacity that Dr. Chris mentioned. I'm really happy with the federal family and their assistance. As it pertains to the second big line of effort is a task force med working with the governor's office, Dr. Chris, and the community on testing. Two specific things we're doing. Just this week, we sent many of our guard medics, have worked up on Navajo Nation doing mobile testing. We sent a team down to Tohono O'odham Nation this week to test a number of folks there on the Tohono O'odham Nation. And then next week, we'll be sending them to White Mountain Apache Tribe to do testing. On the community testing here in the more urban areas, we did receive confirmation today that there's going to be two things coming into Phoenix here specifically. The first are community-based test sites. These are walk-in sites at a CVS, Walgreens, or other type. It'll be free to those that register, not a drive-through setup. They'll be in 5 zip codes here in Arizona: 85008, 85031, 85033, 85035, and 85037. Additionally, the governor mentioned we're going to have a surge team coming in. Hope to have them here next Thursday. This will be a fully federally operated and funded by HHS drive-through testing site, similar to what we saw on the East Coast when this first started up. They'll have the capacity to do 5,000 tests a day. We've worked with the city of Phoenix to pick the 2 sites. They'll have those selections made hopefully by this weekend, and we'll help them with logistics and other things. But the federal government will do the medic staffing, the labs, and all the rest of the equipment that's needed to test citizens. And those will be drive-through sites for 5,000 a day for up to 2 weeks that we'll have those set up here in Phoenix.
Thank you very much, General McGuire. I appreciate your hard work and commitment. And so the last slide is, there we go. Wear a mask. The virus is widespread. You are safer at home. I want to, before we go to questions, I want to thank the people of Arizona. If you think about it, I asked folks to listen to this idea of you are safer at home over the 4th of July weekend. And we do see some encouraging developments in Arizona around a plateauing and flattening, and the objective is decline in terms of these cases. It is likely much easier for folks to find a reason to stay home outside of a holiday weekend. So it's not only been the people of Arizona, I want to thank the press and the media outlets. You've amplified these messages. There's strength in the numbers of people in Arizona participating. The more we can get this out there, in addition to the other news that will be reported, it will help everyone in Arizona. So thank you in advance. And with that, Patrick, let's go to questions.
Thank you, Governor. Billy Harfosh, iHeartRadio. We've got 2 questions for you today. We're basically begging the people of Arizona just now to stay home. How close were you to another stay-at-home order? And secondly, on schools, I think moms and dads and teachers and kids are a little confused. Schools are supposed to be opened August 17th. I know you said politics does not influence your decisions when it comes to this pandemic. The president wants schools open. He's very clear on that. He wants kids in the classroom. What is happening with schools in the state of Arizona on August 17th?
Okay, thank you, Billy. Let me answer the second question first. We're not going to play politics, okay? It's just not going to happen. We're going to do what's in the best interest of the state of Arizona. We share the goal that we would love to see our kids back inside a school. It's going to happen when it's safe. Okay, and I've talked about this. It's got to be safe for our kids. Arizona's in a unique situation right now. I believe that we can navigate out of this situation, but we've got to work with parents and teachers and superintendents. Our decisions are being informed by them. What we do know is our children need an education, and we believe that the optimal place to do it is inside a school. If it's not possible, we can do a lot of this virtually. That's how we closed out last year. It wasn't optimal, but we are going to maintain an objective that we want a child to be smarter at the end of a school day than when they began the school day. And I'll be working with Superintendent Hoffman, superintendents, principals, parents, and teachers around the state to make the decision that's in the best interest of Arizona. On the first question, on how close was I to a different order, I always look at the different options of where we are and what the possibilities are. We want to do what will allow us to navigate out of the situation that we're in right now. We're seeing some results that reinforce that what we're doing right now is possible. Part of this is going to be around public education and public participation. Of course, local or statewide or county mandates can have an effect to a certain degree, but no matter what happens, we're going to be dealing with this for some time. So the better way to do this, if possible, is to have public buy-in to what is the more responsible decision. Not from Mount Olympus or some government entity, but by people in a positive, peer pressure type situation. And that's what we've seen a lot of over the last several weeks in Arizona, and specifically the last 10 days. And since we've talked about wearing masks and arming yourself with the things that have the best defense against this virus. Thanks, Billy. Hi, Howie.
Mine's actually a follow-up to what you were just asked. The President of the United States said, if states do not put all their kids back in brick-and-mortar classrooms, he will cut aid. Some of it might be direct education aid. He has other CARES funds he can do with. What's your message to the President when he says to you, we want the kids in the classroom, or we will take away your money?
Well, first, I want to say that I've got a relationship with the president, and when there's a need in Arizona, I talk to him directly. My senior staff knows this. We've had so much outreach personally from both the president and the vice president that I had to change the ringtone on my phone. And it rings "Hail to the Chief," because I didn't want to miss another phone call directly from the White House to help the state of Arizona. But I stand by what I said, Howie. There aren't going to be any politics around the pandemic played out of the governor's office in Arizona, period.
But what is your message?
That's the message. I'm going to do what's in the best interest of Arizona.
Okay, thank you.
Hi, Governor. So I believe there's several school board members that are sending a letter to you asking to delay the actual physical start date by 5 weeks or so. Have you received the letter? What do you think about this? I mean, are you saying today that we are definitely not going to put children in school on the 17th? What is the actual plan that you're going to do?
Thank you. So we put the date out there, and I said, I think last week or the week before, it's an aspirational date. We delayed it intentionally because of our situation right now in Arizona. I mean, I'm listening to these superintendents. Our decisions to date have been informed by the superintendents, and I know that they talk regularly with the teachers and the principals, and of course, the parents. We have had some schools that are going to start up virtually on that date. They've already made that decision. They've informed their parents. So we're going to continue to work with them. I would say there will be more to follow. We'll know more around this over the next 10 days, and there will be more clarity. I understand there's concern. What we tried to do when possible, and it's a real challenge in COVID-19, is to reduce confusion. The goal is to educate our children in the safest, most effective way possible. And I'm going to work with school leaders and parents to accomplish that.
So should parents prepare to have their kids learning online at least for the first 5 weeks like they're asking?
I would ask them to talk to their local principal on where their head is right now around this. You even while no county in our state has been spared, the situation in our state is dramatically different in 3 of 15 counties, and I'm going to be supportive of local leadership on the education issue with the objective of educating our children
Okay, thank you.
safely.
We're going to zoom for our next question. Lorraine Rivera from EZPM in Tucson. Lorraine, go ahead. Lorraine, can you hear us? You might need to unmute your mic there. There you go.
Hi there, Governor. Thanks for taking my question. I have 2 for you today. One of them is, how many times have you been tested for COVID since this all began? And the other is, earlier today, the mayors of Tucson and Phoenix and several other local leaders have sent you a letter requesting things like statewide mask requirements. Have you already responded to those requests from them?
Thank you, Lorraine. On the first question, I've been tested, I think, 3 or 4 times for COVID-19. I would not be eligible for a test because I'm not sick, I'm not symptomatic, and to my knowledge, I've not been exposed, at least in a less than a social distancing type situation with anyone that has COVID-19. When you are going to interact with the president, you must be tested. So those are the reasons I've been tested. In addition, that I had a full physical and I was tested during that time frame. Secondly, my staff is in receipt of the letter. Local officials have asked for local authorities. We want to encourage that enforcement where possible and where we can do that. I want to applaud local leaders across the state for how they have helped persuade and convince Arizonans that they are safer wearing a mask, and that's going to be the way that we continue to proceed.
Governor, hi. Evan McGuire, Santoro with CNN. At the beginning of your statement, you said, if you don't have anywhere to go, stay home. And at the end, you doubled down on that, saying this is a time of maximum challenge. But in the middle, you said, feel free to go to a restaurant and sit in it if you want to. Is that a mixed message? It sounds like a mixed message to me.
I think you can replay the tape. I didn't think I said that. I said, if you are going to go out, you can do that, head in that direction. I didn't say feel free. I prioritized that you are safer at home. If you're not home, you're safer outside. If you're not outside, you're safer in a place with fewer people. We reduced the capacity inside dine-in restaurants to below 50%.
But in a time of maximum challenge, wouldn't you want to close them down entirely inside? That's what a lot of other states have done.
What I've said is that we want to protect lives and, to the best of our ability, protect livelihoods. And when in doubt, we're going to err on the side of protecting lives.
Thank you, Tina. We're going to go to Nicole now.
Hi, everyone.
Hi, Nicole.
Governor, it's been 10 days since Arizona has heard from you publicly. Access to you and Dr. Christ is nearly impossible. Why are you not communicating and giving more updates if we are basically the epicenter in the country?
Nicole, I'm in front of the press often. It's not been 10 days since you've heard from me. I was here 10 days ago talking about COVID-19, which was June 29th. I was in front of all of you on Wednesday, July 1st, as well, and it has been a holiday weekend, and as we had the announcements that we were going to make, they're today, and I'm here today.
I know when we heard from you with the vice president, it was a lot of thank you. So it wasn't about COVID. We didn't get questions. Who are the scientists
That's not accurate. You asked the question. There were questions.
Who are the scientists you are asking and listening to that say reducing capacity to 50% for restaurants, dine-in is enough? Who are they?
Well, I'm listening to Dr. Christ, Dr. Deborah Birx, Dr. Anthony Fauci, and we talked through this entire plan in detail with Dr. Birx at 1:30 p.m. today.
So no local scientists, modeling experts, no one who
Well,
is predicting.
the modeling that was being done at the CDC was encouraging and supportive and validating to what our decision is doing. And of course, we're informed. Like I said, I am listening to the criticism and I'm listening to the differing opinions.
We know that a just one more. We know that a stay-at-home order worked previously. Why are you not doing what you know works? That little spin wheel that you showed, it said moderate, high, high risk, moderate. In that, pools are in moderate. You shut down pools 10 days ago. So why are you not doing what you know worked before?
I think what we did 10 days ago was to put enhanced guidance so that there weren't groups of 10 inside a pool, which is where we saw the higher risk. And what we've also seen is evidence that the safer at home direction can work, and we believe it can work, and we're going to keep pressing.
We're going to take our next question from Zoom. Kate Davis-Young from KJCZ. Kate, go ahead.
Hi there. Governor, you started by mentioning that more than 2,000 Arizonans who have died of this virus. It's obviously dozens more each day. Can you give us a sense of how many victims' families you've been in touch with and what those conversations are like?
So the first thing I want to say is that my heart goes out to every family that has died in Arizona or across the country from COVID-19. And we want to do everything we can to prevent this from happening in the future. We know the virus is widespread. We know it's happening across our country and, of course, in our state. And we're going to continue to take those actions.
Thank you. We're going to come back to the room right over here, and then we'll go to Jeremy.
Hi, Governor. Even with your executive order delaying the enforcement of evictions, more than 5,300 eviction actions have been filed. Come July 23rd, I'm pretty sure those are going to go up. $127 million in housing assistance has yet to be dispersed. There are so many people waiting for help. How are you going to make sure that come July 23rd and after, renters, property owners will not be removed from their homes?
So, well, thank you for the question. And I want to say that we've worked very hard to increase and strengthen the social safety net in Arizona. There's been hundreds of thousands, if not millions, of Arizonans that were hardworking and hadn't asked for anything from the government that were displaced because of COVID-19 and actions that were taken because of it. In the state of Arizona, we've also worked very hard to shore up our Department of Economic Security. There have been $5.7 billion in terms of social safety net payments that have been dispersed since, I believe, May 1st. We're working with the industry on what the future looks like with this. But I want to say, I think for an Arizonan that had to file unemployment insurance, they have had access to $840 a week since they filed each and every week in doing that. In talking to the industry, the numbers that's been shared with us is 1% of folks are in arrears or haven't worked out a situation with their landlord. So we don't want to see anybody evicted. People that have been receiving part of this $5.7 billion have been remitting it in rent payments, and we want to get a handle on the total situation as we make decisions going forward.
Governor, there are people who should be covered under this executive order and who won't be covered under this executive order come July 23rd, who are being evicted. I don't know if that's the 1% you're talking about, but there are people who are homeless right now, today, being kicked out. What is it? And that's only going to increase come July 23rd. So what can you personally do? You're the executive of the state, right? You have all the power. Literally, you have all the power. What are you going to do
Well,
to prevent that going forward?
We've put the order out there. The order is in effect today. We're going to get our arms around what the facts are around the situation.
The facts are, people are being evicted today.
Well, if someone has
Is
been,
there something
can I
more
answer the
that
question,
you could
please?
do?
Can I please answer the question?
ahead.
Okay. If someone is receiving $840 a week in assistance from the government and not remitting that for their rent, that's not the right thing to do.
I'm just going to stop you right there. This is the last time, and I apologize.
Well,
for
I
cutting
think
you
I've
off.
answered the
But
question.
There are tens of thousands of
I
people
don't,
who have
well,
not gotten that 840.
those are not the numbers that we're receiving from the industry and individuals.
Numbers say 100,000 people haven't gotten it yet.
Jeremy from the Mirror, please go ahead.
Hi, Jeremy.
Hi, Governor. Obviously, we had the local mask ordinances going into effect a few weeks ago, but those don't cover the entire state. We've seen events such as like this past weekend, the Prescott Rodeo, thousands of people, most of them not wearing masks, crammed together. Does that suggest that we need a statewide ordinance and that what's in effect now is just kind of a half measure? And similarly, the same thing with the restaurant closures. We've seen other states just ban in-person dining in restaurants. Is that a half measure as well, when a full measure is needed?
So I want to just say again, I'm a big fan of people wearing masks. We've advocated for people wearing masks. We're using resources to help educate and put out public safety announcements around people wearing masks. The state's responded really well. I think it's somewhere north of 85.9% of the state has that. You have better compliance when you have local buy-in, and any mandate is only as good as the compliance and the enforcement that they have. I encourage all of our local leaders to have their citizens wearing a mask and help them understand that.
But do events like the rodeo show that, where obviously people aren't enforcing that and there are no mask mandates? I mean, again, is that kind of a half
And
measure?
this is where, in terms of local decisions and then local enforcement, is so important to make things happen. And what we want to do is make the best possible decision at the proper level where it will have the maximum amount of effectiveness. And so far, so good with the mask mandates.
Brand next. Brand with 12 minutes, go ahead.
Thank you, Governor. I'm happy to hear you don't listen to us, because I don't listen to us. I listen to experts. I've had to say the last
Greg,
few-
I didn't, okay, I didn't say that I don't listen to you.
Whatever.
That's, okay.
I have to remind people from time to time that we live here too. Everybody in this room lives here. We're journalists, but we live here. We care about this community. And so I'm asking you, as a resident, as somebody who lives here, who's raised a family here, just as you did, on June 17th, there was an order in which Dr. Kara Chris, DHS, told restaurants they could not fill to more than 50% of occupancy. That was on June 17th. Today, July 9th, you put something up there that's described as a new action. Restaurants cannot be filled to 50% of occupancy. What's going on?
We are putting out additional guidance, working with the industry on things that will be effective in terms of reducing the spread.
That's not additional guidance. That's not even new.
I think
it's
we've-
3 weeks old.
I think we've seen,
I have a document from June 17th that was sent out. I know that, but I got the one. from
Okay,
June
can I-
17th.
Yes. So, Bram, we're going to put out what we believe will be effective, and what we've seen over the last 10 days, like I said, working with experts in public health, trained professionals, and we'll continue to do that. And I just want to clarify, because I didn't say what you said. Okay, that's just simply not accurate. So please don't come up to the microphone and attempt to put words in my mouth.
I'm not going to do that. I'm just using the words you had. I'm just curious.
Those weren't the words I used.
Are you waiting?
You feel free to quote me, just try to quote me accurately.
Are you waiting on a plateau? Is that what's in the works? Because
No,
experts-
we want to see a decline. We want to see a
How long do you think that's
decline.
going to take?
Well, over 10 days, we've seen a plateau and some evidence of potential decline.
Jumped again today, didn't it?
We look at it over a course of several days.
We're going to go to Zoom next. We're going to take a question from Dylan Rosenblatt from the Capital Times. Dylan, go ahead.
Thank you, Governor. Recent polling has you as the governor with the lowest approval rating and the only one polling worse than the president. Do you think Arizonans will ever forgive you for how you've mismanaged things throughout the pandemic?
Well, that's your characterization, Dylan. I think that this is going to be a long slog in terms of where we are. I think we are at a time of maximum challenge in Arizona. I'm very confident we can navigate through this. I think that this virus is going to continue in our state, in our country for some time. I know I've used different analogies to try to set expectations for people and how challenging and long this could be. I think I've talked in this setting about it being a baseball game, so there's not a clock here. It's inning by inning. We are in the early innings of this virus, and it's you critiquing a team before we know what the result is. And I am confident, and today I don't think I could have been any more direct in laying out the brutal facts of our current reality, and also talking about the actions that can change our situations. And I'm confident on the other side of this, Arizona will come out healthier and stronger, and every state is going to have, or has had these challenges, or will have these challenges going forward.
We'll go to Bob, and then Andrew from the Republic.
Hi, Bob.
Yeah, how you doing, Governor? I appreciate you being in the firing line for a while. One of the things you said, we've watched for the last month this exponential rise in Arizona's cases. The whole United States of America is watching Arizona, and they've been waiting for something. A couple weeks ago, you did a couple of minor things, but you said the more activity that is happening in our economy, the more the virus spreads. And it looks like if we have another 2-week exponential rise, if this plateau doesn't work out the way you all hope, that our hospitals will be overwhelmed. So why aren't you shutting down the economy now or taking more dramatic steps to stop this major spread?
So we've seen a slowing in this. We want to continue to see a slowing in this. There are other things that we can do. This is what we're doing now. I've said along the way, I'm going to make the best decision for Arizona in real time, given the facts that we have. And like I said, these are not they are my decisions, but they are informed by public health.
I understand that, but like I said, if you're not right, if the plateau doesn't happen in 2 weeks.
Well, we don't have to wait. We have options, and we'll retain those options.
All right, thank you, Governor.
Andrew, go ahead. We'll come over here.
You showed today sort of putting in perspective kind of the rise, the stay-at-home period. So I want to step back and put that in perspective. I want to ask, how did we get here, both in terms of our situation spiraling out of control the way that it has, but also how did we get caught unprepared, given that timeline, for a surge in cases when it comes to things like testing, contact tracing? How did we end up here?
So the first thing I want to say, Andrew, is if you look back, and part of the reason I put that y-axis line on May 15th is to refresh people's memories on where we were after the stay home, stay healthy, stay connected order, and that we never really saw widespread growth in the virus. And after we lifted the order, and if people can kind of search their memories as to what happened, people got out of their houses. People want out. We did see a lot of the pictures and situations, and it, of course, is human nature. People had, for 45 days, basically stayed at home. And for 2 weeks, we still didn't see much of a rise. Now remember, the date 2 weeks after May 15th is June 1st. Now this is something we will know in hindsight. We won't know it today. That's why we just have to deal with the situation. And I said we're in the early innings. Can I finish answering? Much of Arizona, our urban areas, Phoenix, Maricopa, Tucson, and Pima, come inside as the weather gets hotter. And we'll see in the future, but right now, Arizona's inside with circulation happening and seeing the virus become more widespread. The rest of the country, by and large, is more outside and having a different situation than what they did. Basically, our situations were inverted with the folks that were hit first and hit hardest.
We talked during that period, during the stay-at-home order, about using that time to prepare in terms of testing, in terms of bed capacity, and now here we are. Did we not use that time for what we're facing now? I mean, did that not serve us well?
We used every day of that time, and much of that time was to make sure that we had our arms around how we could care and comfort for people, and we continue to do that. Testing has fallen short, and it's really been a supply and demand type issue. When people in Arizona didn't feel that they were sick or symptomatic or want to have a test, we couldn't get the test completed. Like I said, there wasn't demand for these tests as recently as May and June in the state of Arizona. 35,000 tests a day happening in July and 65,000 a day happening in August is going to allow us to catch up. And then it's also the results around that test.
Did we get hospitals? Did we get hospitals to where they needed to be in that time frame as well?
Well, our hospitals are right now, of course, our hospitals are stressed, but our hospitals, our hospital workers, our doctors and nurses are doing an incredible job.
With Fox 10. So can you talk about your new executive order and what enforcement is going to be in place with that? I've talked to a lot of doctors in this past week, and they say there needs to be more enforcement as well as incentivizing businesses that are doing good things. You probably saw that letter. So if you can kind of talk about that.
Thank you, Bailey, and I agree. And I hope everyone heard the question and heard that doctors are asking for more enforcement. And I've had local leaders that are asking me for more of a wide breadth around enforcement. So on the new executive order, I think you've seen some of the complications we've had around the shutting down of gyms and bars and other situations, but we're getting there. And we have used the enforcement of the state, and I want to thank the local leaders that also were involved. So we can work with the Department of Health Services for these enforcements. We can work with the local county health officials and local law enforcement. And like I said, leaders around the state have asked for more ability and a wider latitude around enforcement. This is an opportunity. Of course, we want compliance, and we're seeing by and large, I mean, most people are going to comply, but some people are not, and there does need to be enforcement, and there does need to be accountability, and there needs to be teeth, and that was in last week's order, or June 29th's order, and that's in today's as well.
I've got another question. The doctors sent another letter today asking for a shutdown as well as a mask mandate for the entire state. I'm sure they're very disappointed right now. What's your message to them? They said they're really struggling, as we all know, the ICU beds that are in use.
I want to say I know that they are. And what I want to do is I listen to their input. I want to make the decisions that will have the maximum effectiveness. And where we are in terms of Arizonans wearing a mask and our ability to work with other local leaders to get this done is what I think will be the most effective route.
Thank you.
We're going to start to wrap it up here. We're going to go to Zoom with Nylea Leone from KTAR. Nylea, go ahead.
Hi, it's actually Martha from KTAR. Governor, thank you for taking my question. Earlier in your presentation, you showed a chart that shows the risk of contracting coronavirus for certain activities, and eating inside a restaurant was in moderate high risk. You've just announced a 50% reduction in capacity. But what about the other activities shown in that category, that same one, salons, barbershops, weddings, funerals? Why is there no action there? Meanwhile, tubing has a lower risk than salons, according to the chart. Why shut down tubing but not salons? Casinos are the highest category, but they can stay open. How do you determine the criteria of what to keep open? There doesn't seem to be any consistency. And then finally, just to add on to the enforcement, how will you enforce the 50% capacity at restaurants, and what will be the punishment for those that do not follow it?
So thank you, Martha. And I think you would see consistency if you look at the chart, you look at the highest risk activities, you look at the actions that the state has taken to date to break up large gatherings and to put people in a position where they're around fewer people. We're going to continue to do that. I would also say, I mentioned that we're going to have more prescriptive guidance on some of the other issues around that. And you'll see that will target and allow other industries to operate, but to operate more safely with that guidance. And I think I just answered the question around enforcement. We've got the fire code, we've got local county health officials, we have local law enforcement, and the order stands for itself in terms of what the punishment is, and then the accountability is at the local level.
We're going to take one more question from Hannah Tiede from KOLD in Tucson. Hannah, go ahead.
Hi, thank you so much. I appreciate you taking my question. Governor Doug Ducey, I know you said that testing residents at care homes, nursing homes was very important. I spoke with an 84-year-old man who was discharged from a nursing home here in Tucson, and he tested positive that very day for the coronavirus. I was wondering, where are we at with that effort to have nursing home staff and residents tested in Arizona?
Thank you, Hannah. Dr. Christ, will you take that, please?
Sure. Thanks, Hannah. We completed phase 1 of the testing of the skilled nursing facilities. So we tested all the residents and staff. We are now circling back and starting phase 2 for that testing, as well as moving forward to start testing our assisted living facilities.
Thank you, Dr. Christ. And I also want to say, Hannah, my grandmother is in one of these facilities. I do hear some of these stories about people claiming that there hasn't been testing done. I know our testing's been widespread. I know among some of her friends when we had, was it the nasal pharynge or forensic testing, the very painful testing, some folks, including my grandmother, would refuse to be retested. We have the much less painful and uncomfortable testing going forward, and we're going to continue to target that and the most accurate, effective testing. Of course, we want to see that for everyone, but especially our most vulnerable. Again, I want to thank everyone for their commitment and participation. We are seeing some encouraging results. It is time to keep pressing in Arizona, and the best thing you can do is wear a mask. Make certain that people know that the virus is widespread, and by personal decisions, you can avoid contracting it. And remember, you're safer at home. Thank you.